Welcome to Duke Spine Institute's live stream spine surgery. Our final surgery of December 2024. Our final surgery of 2024. This patient has discogenic back pain, but mostly radicular pain down his right leg. He has a herniation at 5-1 on the right side in the foramen, lateral recess, pinching the L5 and S1 nerve root. His main problem is pinch nerve at 5-1, disc on the right, and he has SI joint pain. So we're going to be treating the SI joint pain with a rhizotomy. That's the best treatment in the world. And we're going to fix the pinch nerve with the Duke laser disc repair. We're going to give you a little numbing medicine. All right, so a little stick and burn. Sorry about that. Our patients are not under general anesthesia for this surgery. They're under twilight anesthesia. I may be too south. Yep. Need to be a bit more north. North is towards the head. Shot. All right, need to be still more north. Shot. We're going to head down to the L5-S1 disc. You can see it's collapsed. There are some degenerative changes. Shot. He's got big facets. That's arthritis in the facet joint. Normal. Not normal, but commonly seen. Normal is normal, but it's abnormal. Shot. But we see it a lot. All right. Shot. AP. Let's see where we are. So far, things are looking pretty good. If you have questions, feel free to ask them. We're going to start with the Duke laser disc repair at L5-S1. Then we're going to move on to the sacroiliac joint rhizotomy. Got a lot of arthritis on this side. How's he doing, Shot?
How you doing, my friend? You okay? How are you doing? I'm going to ask you some questions.
You having any pain?
You having any pain right now? Any pain or discomfort?
Shot? Let's see where we are, AP. I mean, on the lateral view, it looks really good. You can see the vacuum disc phenomenon, the white color in the middle of his disc at 5-1, indicating that the disc is so degenerated that it's pushed all the air out, and when it's actually sucking at air, so there's a negative space there, almost like space. Hold on, Sean. That's looking pretty good. Make sure we're in the disc.
How are you doing, my friend?
AP. Shot. AP. Looks good. We filled the disc. That means we're in the disc. That's where we want to be. Quick AP. Perfect. You can see the tear on the right side. Show us the tear, Jordan, where the dye is leaking out over there on the right. That's where the herniation is interacting with his nerve. Yep. Any questions, Henry?
At this moment, no current questions.
All right. Now let's show the audience how discs can actually cause pain.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see we use a laser to endoscopically shot I think he's just heaving a little. Endoscopically remove the herniation, shot, and shot. And clean the tear so that the disc will heal itself. Shot. Maybe he's just coughing. Pressure. Mm-hmm. Shot. Hold on. Whatever you need. I'm fine with whatever you're doing. Shot. Any questions?
At this moment, no current questions.
All right. Who's going to get the last question of 2024 in?
That's a great question right there. In the meantime, why don't we show the audience how it is that we cure herniated discs?
Let's do that.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. You can see from the video how we repair discs using a laser and a scope. We go to the tear where the herniation comes out, clean the tear, get rid of the herniation as much as we can. That lets the tear heal naturally, takes the pain away, and we can also get rid of the part of the herniation pinching the nerve. So that's what we're going to try to do right now. His nerve is definitely getting pinched. We saw it on the MRI. We just got to find that piece and get rid of it. A lot of times putting the tube in pushes that piece of herniation in, and then I can remove it. This is the new one?
Yes.
It's a tight space, huh? Luis? Why am I seeing this? What do you think? Fiber's nice.
Yeah, he's running.
There's a piece of herniation right there. Any questions, Henry?
At this moment, no current questions.
So we've shown the video on how disc injuries cause back pain.
Correct.
We've shown the video on how we use the laser to fix those injuries.
Correct.
All right. Well, we'll just operate.
Copy that.
I apologize for the poor visibility. We are inside the disc at this point. How's he doing?
Doing great.
Good. A lot of scar tissue here. Can see it. Thick stuff. Bone spur, scar tissue. It's the kind of stuff that puts pressure on nerves. The more we remove, the greater chance we're going to fix this problem. You don't want to get too crazy though. You don't want to try to remove every piece of herniation in the body. That doesn't help the patient. A lot of scar tissue. Impressive how much scar tissue there is. And bone spur. Right here. A lot of bone spur. That's probably what we were seeing on the MRI. It's right at the back of the disc. It's right where the nerve runs. So hopefully this fixes the problem for him down his leg. Our first patient of the day had 5 levels done. I examined him in recovery. His strength before surgery was really weak in his legs. All the muscle groups basically. After surgery he had normal strength except for his toes, which were almost normal. So tremendous improvement in function after the laser surgery. On that first patient we did 5 areas.
We have a question.
Okay.
This
could be the last question of 2024.
possibly. This is coming from Marty on YouTube.
Hi there.
Marty asks, can you do this with multiple herniated discs along with ruptured discs in the same area, as well as having osteoarthritis with bone spurs in that area, or would it be required an open surgery?
No, Marty, we can certainly fix those diagnoses with this surgery. We can definitely do this. This would be the best treatment in the world for that problem. Almost done. Then you can avoid open surgery. Nobody should have open surgery. Very, very few reasons to have open surgery. Things like tumors, fracture dislocation, which you don't have. The vast majority of spine problems are degenerative conditions, like degenerative disc disease, stenosis, spondylosis, bulging disc, herniated disc. But if you get into a high-speed car accident where you crash at 80, 90 miles an hour and you have fractures to your spine, this is the wrong surgery for that. But everything else, this is the right surgery for. All the degenerative problems, you know. Now, infections, typically we don't use this surgery for infections, but we can. If you have a disc infection, this is a great surgery. I could biopsy the infection, culture it. He's wiggling a little. It may just be reflux, but just making you aware. But for all those degenerative problems, this is perfect. This is the best surgery there is. He's not happy. But we're almost done. Just working below the nerve root. Want to make sure we get out as much of the herniation as I can. 1 minute left. And then we'll go on to the SI. Any other questions? Type them up. You may have the last question of the year, Marty.
We have another question coming from Marty once more on YouTube, asking, can you do both the neck and back at the same time?
We cannot do it in the same surgery, but we can do it in the same visit. So if you were to come for a few days, we can do both. We do one on Tuesday, one on Thursday. All right, we're done.
Lights on, please. We always do the back first.
We always do the lower back first. Neck is the second day. That was a 5-1. Everybody agree? All right, thanks for joining us. We will be back with one more procedure called the right sacroiliac joint rhizotomy. You'll have to reset the stream.
Not a
Thanks.
problem.